A question that pops up a lot with my patients is, am I normal? Well, to quote one of my favorite human beings in the entire world, Morticia Addams, what is normal to the spider is chaos to the fly. So whenever we talk about the idea of what is normal, the simple answer is there is no such thing as normal. But the reason a lot of my patients are asking that question is looking at, am I normal? Am I having a average response to this situation or this stimuli? And that's when you get into the idea of normative versus normal. When we look at the idea of normative, or when the expectation of people, society, expectations of patterns of behavior, what is considered normative or a common practice. The problem is, just because it's a common practice doesn't mean that we want it to happen. One of the biggest examples, and this does come up a lot, is the idea of sexual assault. Sexual assault is going to impact 1 in 2 women and 1 in 4 males. And that is an underestimation at the point that we have in our research. And we're still doing more research. And I will, again, long videos, there'll be so many more when I talk about survivors and patterns. But with those numbers and with those statistics that we do know, does that mean that sexual assault is technically normative because it happens at such a high frequency? If you just look at numbers, you go, yeah, of course. But when we look at, is that normal? I hope not. So looking at the idea of, am I having a normal reaction? Yes, because you are having a normal or a normative reaction to an abnormal situation, something that should not be happening. So being able to find some kindness towards yourself and going, you are having a legitimate, understandable, valid response to a situation that should never have happened. And yet, in particular cultures, the US in particular, in certain cultures, that experience or that event happens at such a high frequency that it now is considered a normative pattern of behavior. Just because something happens at a high frequency doesn't mean it should be. And that's when we look at changing those patterns of thinking or those responses to how we are thinking about our reaction to shitty situations.